Certainly it seems like Ebola has really been the headline in several news markets for the last several days. We know more than 3,000 people just in West Africa have died from it. It is the largest Ebola outbreak in history. And of course, there are also concerns of it spreading, not only to West Africa. We saw it spreading in Spain, but now here in the U.S. Dr. Sabrina Fabi is here from San Diego. Dr. Fabi, a couple things I want to talk to you about. One is the myths, but before we get to that, we were talking even before the show about sort of this fear that is surrounding Ebola. We've seen this with people who get off a plane and they're showing some symptoms and people are kind of freaking out. Do they have some validation toward that fear?
To be honest, Jen, common things are common, right? And so some of the symptoms of Ebola are very similar to symptoms that we experience even from the flu. Fevers, headache, malaise. And so I think that we just don't know enough about the Ebola virus. Classically, it's been something that has been spread only through direct contact. It has never been an airborne illness that we know of or one that's disseminated through water. And so, yes, there are concerns, but we have to remember common things are common. So symptoms that are flu-like may just be the flu or maybe malaria if someone is coming from West Africa. But there is some validity to the concern, yes.
All right, let me talk to you about the amount of time that it takes for symptoms to show up, because there's been a few cases, for example, with Thomas Duncan. He didn't have any symptoms when he got to the U.S. from Liberia, and then a few days later, he did show symptoms. What do we need to know there?
We need to know that really it can take up to sometimes 21 days for the true symptoms to manifest, and that's generally because the virus needs to replicate enough in order for there to actually be high enough viral loads or counts in the blood for you to actually manifest and have symptoms. And that's part of the scare, because you may not necessarily be able to detect the virus the classic way that they're detecting it through PCR techniques or through antibody techniques to actually monitor for the antibody against the virus. And so that, when you use those testings, it can take between 3 to 5 days after initial exposure for those tests to even come back positive.
Right, so you're talking someone from Liberia could basically get on a plane tomorrow, have no symptoms of it, be on the plane, and actually have the disease.
And they just don't have high enough viral counts in their blood to test positive based on the tests that we presently have to detect for this illness.
Right, man, that's scary. All right, let me talk to you about animals, because in this last story we saw that health officials in Spain said that they needed to euthanize that dog from the nurse who ended up contracting Ebola. Talk to me about how it works with pets.
That's very hard, because these pets generally do not manifest the symptoms that we see as humans when they are positive for the Ebola virus. And so then if they actually transmit it, if that's even been proven, which it hasn't, because we don't have enough evidence to know if it can actually be transmitted, it would be through secretions, like any type of defecation or urine, and having contact with that and not washing your hands thoroughly, I suppose.
Right.
Classically, it's really been through mammals and through fruit bats, which chimpanzees, apes, those are common animals that have been known to actually transmit the virus to humans.
All right, before I let you go, I want to talk about some of the myths with Ebola. Give some of them to me.
So, common myths are that the Ebola virus can be actually transmitted through airborne pathogens or through water. And that is a myth, because it really can only be transmitted, from what we know based on the 4 strains, through direct contact of bodily fluids, whether it's breast milk, semen, or blood. Another myth is that it can be infected without symptoms. That's a myth, because it actually has to take between 3 to 5 days at minimum after initial exposure for there to be enough of a virus in one's blood to then be able to transmit it to someone else, but sometimes even up to 21 days.
Dr. Fabi, let me interrupt you real quick there. It says, can recovered patients spread the virus, yes or no?
No, because once it's actually negative in that person's blood, they can't transmit it to somebody else.
All right, and lastly, really quickly, is it safe to travel right now, in your opinion?
It is safe to travel. It's probably not advisable to travel to endemic areas such as West Africa, but beyond that, the CDC does state that it is safe to travel.
All right, Dr. Fabi, thank you so much for a topic a lot of people are talking about. We appreciate it.
Thanks for having me, Jen.